Okay, so yes, I'm Janika Huston, MSW student at Savannah State University, and I have been working with Bibb County DFCS for 3 years in CPS, but I had the pleasure of interning in the foster care department, which was a big difference. So in foster care, I had a client. He was working his reunification case plan, and he was struggling. He had lost his job, he had lost his car, his home, and it caused him to go into a deep depression. Like he wasn't eating, sleeping, and he wasn't doing his normal parenting abilities. He couldn't take care of home, which caused the kids to come into care. So we had to do a referral to Rivers Edge Behavioral Health so that he could get services, and that's where he was actually diagnosed with depression. After that, the therapist recommended cognitive behavioral therapy for him. So CBT is based on the belief that thoughts, emotions, and actions are all related. CBT helps clients by giving them tools to alter their cognitive distortions that bring negative effects on their mental health. Okay, so once CBT was implemented, we actually used a 10-item scale where he was asked questions every week for 8 weeks. He was asked a series of questions like, I felt happy today, and he would have to answer whether he agreed, disagreed, or he felt neutral about it. So there was like some positive questions, negative questions, just so we can monitor his way of thinking, so we can see if CBT was actually working. The treatment, like I said, it was provided once weekly through therapy sessions. And here is the assessment, which was when he was diagnosed with depression, and we implemented the intervention with CBT. And the whole purpose of this was to see if he would regain self-control, make him want to become more involved socially, improve his thoughts and appetite, and become more active. Okay, so then we also tested data for autocorrelation. In phase 1, who was at a 0.85, and in phase 2, who was at a 0.24. There was a trend detected, and what that basically means when we test the data, it is to show whether his depression got better or got worse. So there was a 50% decrease in the desired direction, so that showed that CBT was actually helping him. The client was receptive and compliant to receiving services, and it was beneficial for me to gain a better understanding of the effectiveness of CBT as an intervention for depression, as well as gain a practical experience in utilizing and assessing evidence-based treatments. It was concluded while using cognitive behavioral therapy with the client, it helped him overcome negative thought patterns, regain self-confidence, and improve his overall emotional and behavioral health. So I was able to learn to measure fluctuations in the independent variable by selecting a tool appropriate for this context. And yeah, that was pretty much it.